Schools network has been quite widely implemented around the world. McComa and Flischer conducted a review of health promoting schools, and they came up with 9 studies that satisfied their criteria for inclusion in this study. The criteria that they used in order to include the schools was that the school had a whole school approach to health promotion, that the study used a comparison group, or they had before or after measures, and that health related outcomes were adopted. For the whole school approach, I've covered it in the slide here, that the school had to have a whole ethos in which health promotion was considered to be favourable, that the environment of the school was conducive to health, and that the curriculum adopted appropriate measures for teaching, for knowledge and skills, and that there were family and community networks that were favourable to health promoting schools. And McComa and Fisher found in these 9 studies that there was evidence for effectiveness in some domains of health, such as increasing exercise and improving healthy eating. And they also found that it was possible to integrate effectively health promoting activities and activities into the curriculum. In Brazil, Moises et al. Looked at health promoting schools. They examined 33 schools and looked at caries and trauma in 12-year-old children. And they found that in the health promoting schools that the oral health was better in those 12-year-olds, looking at those measures. They assessed the schools according to the criteria given here, and then deemed them as either supportive schools or non-supportive schools. And I'll just run through those criteria. So the schools had a health policy which was favourable to health promotion. So not only the activities but the funding was there. And the schools would have policies on food, alcohol, smoking and drugs, as well as having given responsibility within the school to somebody for health education and health promotion. The physical environments were conducive to health, and for that they looked at things like traffic control, minimising hazards within the school, as well as environmental programmes taking place in school. For the social environment, the measures that they considered were the relationships within the staff, within the students, and then between the 2 groups, as well as relationships with the community and parents. And it's worth noting that there wasn't any formal dental programme in any of these schools. So having satisfied these criteria, schools were deemed as supportive or non-supportive, and they actually found that the children had better oral health in the supportive schools, despite the fact there was no particular oral health intervention. In England, in Kent, the Heart in the Mouth project involved a number of interventions in which the environment in which children were eating mostly was measured. And a number of interventions were tried, including the positioning and presentation of food, such that healthy foods were more accessible, the pricing of foods, the availability of healthy foods at different times throughout the day, lunch, snacks and vending machines. They also looked at training dining room supervisors so they could advise children on healthy eating, and providing food in a combination, a bit like a McDonald's meal type arrangement, so that those foods at a reduced price may encourage healthy eating. And in fact, they found that those first 3 did produce some favourable results. Unfortunately, this is an unpublished report, so we don't have very good information on the evaluation of that.